The cultural aspects of caring for our elders is something that is intimate and different in every home and every background, right? But oftentimes rooted in that same sense of reverence and care to and honor to be able to pour back. You use that phrase, pour back into the people who loved you. You can pour that back into them. But navigating that in this country is very difficult, right? My family's from the islands. I remember my mother used to write letters and send money back. And it was my grandmother was cared for in her home by people who knew her, who knew my mother. And it was that type of tight-knit community. But nowadays, people live far and wide from each other. Multi-generational homes are not the norm, right? And how are we able to support people who have this family disease process, right? Um, Appropriately for what they're looking for, and address those issues like mistrust in the system, language barriers, all of those things that are social determinants of health that are also going to make navigating elder care, Alzheimer's care a little bit more difficult. What do you see out there in the community that are services or ways that people can be supported as they care for their loved one?
So there are, I'll tell you, the most organic is when people open their mouths. When you're at a church, when you're in line at the grocery store, if you're
Mhm.
having a bad day, particularly if you're a member of the sandwich generation,
Sandwich
taking care
generation.
of your parents, taking care of your kids who are adults, but then taking care of their kids. Then while you're trying to manage and balance a life. And again, in New Orleans, when we ask you how you doing, baby, we mean how you doing, baby. We'll sit there and look, how are you all right? If not, what happens is I tell people that, a lot of times what we need to get back to the time where we talk to each other. There was a time during the pandemic where people had nothing else to do but talk over the fence to their neighbor and to get to know one another. And that's when the exchange of resources comes before things become too late. Offering, is there anything that I can do to help you? Did you know that when my mother went through this, we had this and we have that? There are a number of different groups out there and they're operating in silos, even the support groups, the dementia and Alzheimer's support groups. There are a number of them, but a lot of times you'll find that they're silos. They don't talk. And I'm sorry, but I have to go back to, it comes back to communication. It comes back to having frank conversations, there's no competition for Alzheimer's resources and patients. Well, we're helping 10, we're helping 100. No, we're all in this together and we have to spend time, talking among the resources need to talk to each other, and then they need to go and give it to the community and let them know that they exist, if that makes any sense. And feeling free and comfortable. What I found, I'll tell you, one of the places that I really just admired the healthcare system, especially the community nature of it, was in Cuba. It was a very health literate population I found when I was there, and they talked freely about things that might be going on to support one another as they get through it. Going to see a doctor can be very frightening, and that's when I take off my doctor hat and I'm the patient. It's tough. I use my 4-letter words. How you doing? I'm fine. Are you good? Oh, it's good. It's great. And all you might hear is the bad words. You might say, well, Eric, it's good to know that you do not have the genetic predisposition for Alzheimer's. As Eric, my cortisol kicks in. Dr. Greenberg said I have Alzheimer's. And now I have to go talk to Dr. Nugent, as opposed to having someone being accountable, having that communication, accountability, bringing someone with you to the doctor, talking to someone. We've isolated ourselves with these cell phones that just contributes and makes the problems even worse when it comes to helping each other. That makes sense?
It does. It does. And something that I think is really lacking in the community, that I find for my patients ties a lot of this communication issues together, is the idea of caring for people where they are at a certain point in their age, right? I think we're doing like very aggressive things for patients who are older, and who are having trouble navigating the system that's already very broken. And their kids are having trouble navigating that system that is also already very broken, both in the medical system and then all the community supports. And I find my patients who see geriatricians to have a very different experience.
Mhm.
They have a much more like holistic, slowed down type of view and a longer view of where they're going and how they want to get there. And I often marvel that that is a specialty that I personally like think would do wonders. And not maybe a geriatrician every corner, but teaching us how to rethink of how we're caring for our older patients. I have these frank conversations in hospitals, right? In the hospital, you have no choice but to have frank conversations. And when I say things like, is this really what we want to do? That's the first time someone may have said that to them instead of this is standard of care and this is how
Mhm.
we do, right? So reframing the amount of care to what people want and meeting them where they are in their journey rather than this is standard of care. I'm going to get graded on my HCAPS for this. I'm going to get dinged for not doing X, Y, and Z. And meeting that community in a place that allows them to make those decisions, have those difficult conversations, tie into community resources, and spend the time with their healthcare provider, getting things like access to trials, right? You'd be surprised at how many people want to participate when you slow the conversation down. And it's not boom, 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 boom. I'm going to say a lot of really medical words to you and make you feel, like you said, Dr. Nugent said, I'm sick, right? I remember my aunt told me when she was diagnosed with cancer, the doctor said to her, don't worry, you're healthy. And she was just like, you just told me I had cancer. And then the next thing you told me was, don't worry, I'm healthy. But you told me I had cancer, right? And so she didn't hear past what he meant was, you don't have heart disease. You don't have high blood pressure. You have other things in your corner. And you're right, people don't hear past a certain point when you're the patient. And I do think slowing down, meeting people where they are culturally, meeting people where they are in their health journey, being more appropriate with how we're caring for our elders, and then getting those community organizations to talk to one another. That's a big one.